Nearly 116 million shots of the coronavirus vaccine have now been administered, including enough to fulfill President Biden's promise well ahead of schedule of 100 million shots in 100 days. Right now, I think it's day 58. But some Republicans are still very skeptical of efforts to fight the virus, as you can see in this tense exchange on Capitol Hill yesterday between Dr. Anthony Fauci and Senator Rand Paul.
You want people to get the vaccine? Give them a reward instead of telling them that the nanny state's going to be there for 3 more years and you got to wear a mask forever. People don't want to hear it. There's no science behind it.
Well, let me just state for the record that masks are not theater. Masks are protective. And we
have immunity there, theater. If you already have immunity, you're wearing a mask to give comfort to others. You're not wearing a mask because of any science.
I totally disagree with you.
Dr. Anthony Fauci joins us now. He is President Biden's chief medical advisor and the country's top expert on infectious diseases. Good morning to you, Dr. Fauci. So when are you and Senator Paul going to lunch? Let me just say, as the kids of today say, he really seemed to be coming for you, but you can certainly hold your own on this topic in particular. But were you a little taken aback by his line of questioning? And what is a message that you wanted to make sure that we all hear loud and clear?
Well, I mean, Senator Paul has this message that we don't need masks, which goes against just about everything we know about how to prevent spread of the virus. He was quoting literature selectively and leaving out important studies which actually show that people actually can get reinfected. His point was that if you're vaccinated, you shouldn't be wearing a mask. In fact, as the more people get vaccinated, just put masks away. It's theater. That's ridiculous. I mean, and anybody who knows the literature, I mean, just the other day, yesterday, the day before, paper came out showing that in individuals who are infected, particularly the elderly individuals greater than 65, they have a high incidence of getting reinfected. So he was saying, if you've been infected or you've been vaccinated, don't wear a mask, which is completely against all public health tenets. So he's dead wrong. I mean, I don't have anything personally against him, but he's just, quite frankly, incorrect.
Now, we should point out that he is an eye doctor, and you are an infectious disease expert, just saying. Let's talk about the AstraZeneca vaccine. It was pulled in Europe, and now it's back on in Europe. Do you know when it's coming here, and should we be concerned? A lot of people are very worried about this one now.
Well, I think we just need to go with the data. Right now, it has completed a randomized placebo-controlled trial in the United States. The data are currently being examined at the level of the Data and Safety Monitoring Board. I think it's important for us to hold back any judgment until we see what the results of the deliberation of the Data and Safety Monitoring Board that is assigned to the trial in the United States. There has been some concern in the European situation as to whether or not it was responsible for blood clots. The European Medicines Agency, the EMA, which is the equivalent of our FDA, feel there is no direct association, that it has occurred, these blood clots, but not to a degree that was significantly greater than what would occur anyway. That's their determination. I don't want to make a judgment on that. I'd like to see what our data show. And that will be imminent. I think we're going to be hearing about that in the next few days.
Okay, recently, infectious disease expert Michael Osterholm, you know him, painted a very scary picture of the variant that was first found in the UK and what it could do here. So when we spoke to him, he was talking about what it could mean for schools reopening. I want you to hear what he had to say and see if you share the same concerns.
Right.
There really is a real red flag coming down the road, I think, and that is these new variants that we're talking about. This particular one from the United Kingdom, I think, is going to cause such a surge in cases over the course of the next 14 weeks that I think a lot of schools are going to be challenged to open at all.
What do you think, Dr. Fauci?
Well, I mean, that's taking an understandable but somewhat pessimistic view. I think that certainly is possible. Michael is clearly, correct in saying that it's a threat. But the one thing that we need to understand is that the 117 variant, which is the one that has been dominant in the UK and is currently becoming more dominant here. So in that respect, Michael makes a good point. But the vaccines that we use now are very good in protecting against the 117.
Okay.
So my response would be, our response to that is two things. One, get as many people vaccinated as quickly as you possibly can. And two, continue to implement the public health measures of mask wearing, notwithstanding Senator Paul, mask wearing, avoiding close contact, and avoiding congregate settings. If we do those two things, we can blunt a potential surge. But Dr. Osterholm is absolutely correct that if we don't do those things, there is a threat that we will see a surge coming up.
Yeah, I think people need to constantly be reminded about the rules. And if you've been fully vaccinated, do you need to still keep getting tested?
You know, not necessarily.
Okay.
In fact, I wouldn't say that that's something that you should do. If you've been fully vaccinated with 2 doses of the mRNA or 1 dose of the J&J, I would not be considered, unless you develop symptoms that were suggestive of COVID, but not if you're without symptoms.
All right, Dr. Anthony Fauci, always good to have you here. Thank you so much for your time.